As you know, this is breaking news. So we have assembled our experts together. We have Dr. James Carden, who's our Chief Clinical Integration Officer at Hartford HealthCare, as well as Keith Grant, our APRN, Senior System Director of Infection Prevention at Hartford HealthCare, whom you all know really well. So thank you for joining. And Dr. Carden, let's begin with you to kind of give us an overview of where things are right now.
Sure, and appreciate everybody coming together to help us get this information out as we are both learning and in the process of getting more details as this goes forward. At present, we were notified of the suspension for administration of the J&J vaccine, which we have right now halted at all of our sites so that we will not be administering that vaccine at any of our locations until further notice and we understand more clarity around what is occurring. The concern is around the formation of blood clots, a rare event that happened in 6 patients in the U.S., which prompted this pause and need for investigation. We will not be using J&J until that all gets investigated and clarified. Do want to state that we have not seen any complications of blood clot in any of the vaccines we administered, and as none have been reported in the state as well. So to date, thankfully, no patients have been affected. As we move forward, it is not going to significantly impact where we were using the vaccine right now. Most of our sites were using the mRNA virus, vaccine, and the places where we were using J&J, including our work that we had just started around hospital transitions and ED have been halted, and the mobile sites, given the recent reduction in J&J administration, we had not been had no significant events yet in terms of where we were using J&J. It does clearly have some implications long term in terms of our strategy, but we will just have to watch and see what that happens as we go forward. Keith, anything that you want to add specifically around where this is as we're developing, and then we'll open it up really to your questions.
I agree with everything you said. You know, it's very, very unfortunate at this point in time, but again, we're still getting data and having an understanding of the data. I think the CDC and the FDA did the right thing. And as you know, as did we and other systems across the country in pausing the use of this until we get to review the data. One of the good things about this and appreciation, I think something we should appreciate is, you know, versus any other medical process probably in our time, has this been so well, you know, reviewed, publicized, and just monitored. So we're able to pick up on this deviation really, really quickly, if it is an actual deviation, right? So we're able to pick it up really quickly, and nationally information goes out and institutions have paused on this. So again, just want to stress, very rare event that's rare in general. And we have some specifics about data, but about age and so forth, but there's not enough that we have right now that we can make any conclusions on. So we're in a position of just waiting at this point.
Yeah, and be clear, is what we know is that it's not clear that this was a cause and effect. This kind of disorder does happen spontaneously. It's an autoimmune kind of event that can occur. The concern is the vaccine triggering that response, that out of significant abundance of caution to make sure that we're not doing any harm. We completely adhere to that with our culture and values. So we will be extremely cautious to ensure that you know, before proceeding, that we have good line of sight as to whether there is a cause and effect between the vaccine and the development of this rare complication or this rare event. Questions?
I have a question, Dr. Carden. This is Matt Karen from Fox 61, and thanks for doing this. Hi. So something similar obviously happened in Europe with AstraZeneca. Both of these vaccines, AstraZeneca and now J&J, are adenovirus delivery mechanism vaccines. I'm wondering if you could just talk about that delivery mechanism and, why that may or may not be, something that's triggering this clotting.
Keith, you want to take Pessa? You want me to? I'm okay either way. I'll make a first go round, and then he can hold me. He can hold me honest. I'll caveat this with certainly not an immunologist or hematologist. But the question is given the delivery vehicle is different than the mRNA viruses, is there something about using an adenovirus that is somehow triggering an antibody response that cross-reacts and activates the clotting system? And the potential that it's not the COVID, it is the delivery vehicle could be playing a role, I think is giving everybody caution to be very suspicious when we saw this coming out as it moved forward. So that would be that's a lot of speculation, but that I think is what has caused some of the concern. And
just as a follow-up, I believe we're only seeing this in women so far. The 6 cases have all been in women. What do we make of that? And did we see any evidence of clotting during the trials that were done?
So, that's a very good question. So this is one of the pieces of specific data that I just spoke about, that we do have some age ranges, and we have some specificity around specifics around sex, right? But again, the conversation that's being had actually right now with the CDC and the FDA will provide way more data. There's so much conversation that needs to be had about this before there's conclusive statements. The risk factor does exist for clots in a certain age group with certain other medication. There's a significant amount of pieces that can cause this. So at this point, it's very difficult to look at the data that we do have and create some conclusion or create some narrative that could potentially be, if anything, harmful. So we're still waiting for more information to come out from the CDC, or especially with the conversation that's started at 10 o'clock with the CDC and the FDA in regards to the current EUA.
Yeah. Keith, sorry, Dr. Cardin.
No, go ahead, man.
I was just going to ask, but Keith, given the data that we do have already from the trials, I was just asking if we've seen any clotting in those trials.
Yeah, there's no clotting in the trials for the Johnson or Johnson & Johnson vaccine that was initially reported.
Hi, this is Liese Klein from the Hartford Business Journal. I'm wondering, do you have any concerns that this will increase vaccine hesitancy, especially in underserved communities?
Well, not just in underserved communities. I think it will. I actually don't think it will be an impact in underserved communities, because J&J was never targeted. It wasn't used to target the underserved communities at any point, right? And the hesitancy that we've seen over the last few months or few weeks, I think a lot of this had to do with, and Liane from the mayor's office speak of this a lot, and I've quoted her a number of times. There's a difference between hesitancy, access, and education. And once we created certain specific access points and provided a number of education in any community, we had good compliance. I think the unfortunate thing is, it does add some cloud in a situation that already had some people very cautious, right? So that's something we have to be careful of. And one of the pieces of this, and the importance of this, is the clarity that needs to happen with the data and the FDA and the CDC coming out and putting this public forum of conversation right now that's going on, very important. Us having this briefing and communication with the media, again, very, very important. But it's important for us to appreciate the data, see what the eventual narrative is, and how this will impact. There's a number of people right now who's taken Johnson & Johnson who have spoken with this morning that are very, very concerned. And it's for us to look at the data and see how we can help and support these individuals as much as possible through this time.
Yeah, and I want to report down that. And I realize there's a tendency for us all to try and speculate and figure it out before we know, but that also causes sort of an anxiety. So that there is an unknown we need to deal with. In order to deflect, I don't want to potentially increase anxiety where it's unfounded by speculating as to how, why, or even if it's related to the vaccine. We need to investigate it, but it's really important that we don't undermine the benefits of this with speculation if before we have some facts or at least some better data to support that there actually is a linkage between the vaccine and this complication.
It looks like we have a question from Susan from the Associated Press. Hi, Susan.
Hi, thanks, Tina. Yes, hi, this is Sue Haigh with the AP. Doctor, you mentioned that Hartford HealthCare uses J&J in hospital transitions and in the emergency department. First of all, I was wondering if you just kind of define what a hospital transition is, and how many people are we talking about that you were planning on giving J&J to? Thank you.
You're welcome. Yes, we had just initiated vaccinating appropriate folks who are in our acute care hospital who are eligible and willing to take a vaccine, especially we call discharges transition. So that's just the language you'd be more familiar with discharging from the hospital, but specifically transitioning to congregate living places to where they have not had vaccines. So we had just started that program across our 7 hospitals, and we're rolling that out. And we initiated an opportunity for those who were being seen in our emergency rooms to also receive a vaccine, if again clinically appropriate and looking for access to a vaccine. That was a very small. We just really started that this week. We've done about 100 people that were transitioning out of our acute care facilities and had just started the ED, but all of that has been suspended at the moment, Susan.
John Craven from News 12 Connecticut.
Hi, everybody. Sorry, I jumped on a little late, so I apologize if I asked something that you already went over. So it sounds like from the release you guys put out this morning that if I'm reading this correctly, that you weren't really using much of the Johnson & Johnson currently?
John, we had just, because that we saw a reduction in the allocation we got from the state, the amount of Johnson & Johnson vaccine we had available had been curtailed as we went forward. So yes, that is true. On a go forward basis, we had really continued to not have as much J&J to use, and we're restricting its use to some very specific opportunities to where it would be the easiest and simplify the need for returning for vaccines and other second doses and the like. We had been distributing it before though, so that this was a more recent in relation to the state getting less J&J because of the production issues.
So,
Right, we're gonna go ahead.
Oh, sorry, just one follow-up, Tina. So given that though, there's obviously going to be a run on Pfizer and Moderna now because everyone who was giving out J&J is going to be trying to get those vaccines. Can you talk about, how that could affect your supply chain moving forward?
Yes, although we continue to flex our allocation and vaccine appointments to sort of meet the week-to-week variability that we've got in distribution of the state. So we partner very closely, understanding what is our baseline distribution for the upcoming week of the various brands of vaccine, and then we allocate appropriately. The ability for us to expand when we get additional vaccine that we weren't anticipating is available to us, so that process doesn't really change. It's just the amount of people we can vaccinate in any given week will be affected depending on the total of the vaccine that we're administering. All of our vaccine sites will still be open. We except for interrupting what we're doing around the hospitals. Right now, it is we can fully operationalize what we're doing with our current allocation of the mRNA vaccines.
All right, we're going to go to Emily Brindley next from the Hartford Courant, and then Shantae Passmore from Channel 3. Emily?
Hey, everybody. I was wondering if you just might be able to put some numbers to how many appointments you think will need to be rescheduled for this week. My understanding is that you'll be trying to fill some of those appointments with Pfizer and Moderna, but will there be some number of appointments just completely rescheduled from this week?
The only thing, Emily, we've had to interrupt, as far as I'm aware right now, is that we were doing a second dose mobile clinic where we were going to allow folks who hadn't never had the opportunity to get vaccinated to get a first dose, and we were planning for Johnson & Johnson there. We're just going to be able to move that into our mRNA. So really, it does not disrupt a significant amount of the appointments that we had laid out, simply because we had scaled back the J&J administration at our sites preemptively. So it's fortunate in some way. I wouldn't have told you that yesterday, but that we didn't have a lot of J&J clinics and not available in any of our sites for this week going forward.
Okay. And then an unrelated question to that, for patients who have already gotten the J&J vaccine, can you talk a bit about what they should be doing, if they should be monitoring their symptoms, when they should call their doctor, that kind of stuff?
Yeah, I appreciate that question very much. So if you're having concerning symptoms, and I'll give you a high level of of what to watch out for, certainly calling and checking with your physician is the right thing to do. The symptoms that you're going to be that folks could experience are related to the formation of blood clots. Typically, this would be pain and swelling in the extremities, where veins get blood clots, and therefore can cause some swelling and pain there. Abdominal pain can be a symptom of blood clots. And then typical stroke-like symptoms, headache, weakness, numbness, visual changes, all should prompt a call into your clinicians. Lastly, as part of the unique way that these blood clots form as opposed to others, you can also find that people get a rash on their extremities that sometimes can be a marker of the reaction of this activation of blood clots. We'll have additional information as it becomes available, always on our vaccine website, and obviously our call center is also available to ask questions if you can't get through with your clinicians. So, Emily, something to watch out for, and certainly if there's concerns, again, contact your physician is a good place to start.
Thank you.
Hi, good morning. We're talking about 6 cases, and the operative word I keep hearing is this is rare. Do you still consider the J&J vaccine safe? I'm thinking about the nearly 7 million people who already received it. And then my second question would be, even if J&J gets back online, do you believe people will trust this vaccine option?
Again, data is and information is still forthcoming. I think that we really need to ensure that the authorities, the CDC, FDA has a chance to really look in and sort out exactly those questions. Is there a cause and effect between the vaccine and the development of this clotting disorder, or is it true unrelated? We know that things happen, and this disorder happens spontaneously. So when as you're looking at just 6 cases among the millions of doses that have been administered, I don't think that I would right now say that the vaccine is not safe. There's not any evidence that I would have confidence in making that statement. I think it's up to us to give clear information, be completely transparent about our data, and explain this, because there's no question that anything untoward, creates fear and anxiety, and we want to make sure that we don't accelerate that. We don't have all the answers yet, so we just have to be patient and wait. But at least at this point, with a lot of studies going on, we hadn't, nobody had seen this kind of complication. So it's just we have to deal with the information as it comes forward. Keith, do you want to weigh in on any of that?
No, I mean, you know, it's a very, very good question. And it's something that we obviously have to think about. Is the vaccine still safe? I would say absolutely, based on the data that we've had so far, and based on, keep in mind, nothing on this is concluded. Like we've seen, we do have the ability, and we said this in the beginning of it, we will maintain the ability to keep monitoring these vaccines and its administration. And if something comes up, we'll decide as a science community and a general community, healthcare community, how we're going to address this. And I think the key points on this is, I think this is the best way to address this current situation based on the limited data we have. Let's put a pause and see what's going on. But the fact is, if you look at clots, not to minimize this at all, but clots in general in the US, you know, anywhere between 300 to 600,000 a year, blood clots. So again, a disease process that, you know, as rare as it is, keep still, you know, look out for, and generally, as Dr. Carden say, with some key signs and symptoms. So individuals that's gotten the vaccine, you know, definitely be aware of the potential signs and symptoms and look out for it. But for us right now is to control the narrative in regards that there is still data that needs to be looked at. Is there a true correlation? We need to figure that piece out. And if there is a true correlation, how do we look at and appreciate the usage of this vaccine in the next few days?
Question from Nick from Hearst, Connecticut Media. Nick?
Morning. Is Hartford HealthCare planning any sort of directed outreach to the people that have received Johnson & Johnson vaccine?
We will, go ahead, Keith.
Yeah, at this point, our focus is to do a general communication to everyone and give everyone the opportunity. We have a lot of traffic that go through, you know, just hartfordhealthcare.com to our providers, individuals contacting their providers. We have a very extensive network in that regard. So giving individuals the opportunity to contact us, communicate with their providers, giving the information for what they need to look out for. And again, stressing the fact that in the current situation, there's something that we're not too sure about, which is key. And because of that, we're just going to put a pause on this. And these are the things for you to look out for. So that's kind of the basis of what we're doing.
Nick, we do have the ability through all the ways we've communicated with our folks, and part of the way that we, part of our safety and follow-up, have the ability to reach out and make sure that they have the most recent updated data. So this is a pretty routine process for us in terms of being able to communicate directly, so that as we have the ability to kind of continue to inform and provide additional information, we will be doing that.
Any other questions from anyone? All right, just a reminder, we will be hosting another news conference later, so stay close to your email for a media alert. And as soon as we have that up and running, we will alert all of you. So thank you for joining on such short notice again. Thanks, Dr. Carden, and thanks, Keith.
And please give us feedback if there's anything else that we can be helpful to for you guys to provide information. This is important to keep the facts straight. So I really appreciate you taking the time to meet with us.
Thanks, everyone.